Welcome to the Stay Visionary podcast, where we spotlight innovators redefining their industries through technology, leadership, and purpose. Today's guest, Dr. Muhamad Aly Rifai, is a dual-trained physician in psychiatry and internal medicine and founder of Blue Mountain Psychiatry, a leader in integrated mental health and digital care. We explore how he's merging medicine, advocacy, and AI innovation to build a more connected and compassionate future for healthcare. Welcome, Dr. Rifai.
Thank you very much for having me. I am very excited to talk a little bit about artificial intelligence and kind of its impact on the field of medicine and specifically on the field of psychiatry and how it has kind of enhanced my practice as well as enhanced the experience that my patients see in when they interact with the healthcare system.
Okay, so Dr. Rifai, what has inspired this journey of both psychiatry and internal medicine, and how do these two worlds overlap in your work?
Sure. So I have been in practice for about 25 years. I did my residency training in internal medicine and psychiatry. And just because of the interaction between medical problems and psychiatric problems. So a lot of people who have psychiatric problems have medical problems. A lot of patients who have medical problems also have comorbid psychiatric issues. So I did my training in the combined field of internal medicine and psychiatry. I'm board certified in internal medicine and psychiatry. And I have a huge patient population that suffers from both medical and psychiatric issues that we tend to. And just been in practice for 25 years, and it's been very, very busy. I am a lover of technology, so I'm an early adopter. So now in medicine, we're doing this interview by video conferencing, but I started doing telehealth in 2006 when it wasn't popular, when it wasn't, nobody had heard about it, where you had to have dedicated equipment. The early days of the internet, you had to have dedicated equipment for the telehealth, basically equipment and the screen and the connection. It was a huge server that weighed a ton. And basically, and it cost $5 million to connect 3 hospitals through a telemedicine connection. Now you can do it for $10. So just to show you how the expense have gone down and how things have progressed. Same thing. I have been deploying telemedicine for ambient transcribing of my notes since 2018. So I've been doing it for 7 years, and it has expanded significantly. I started with my private practice. Now it's being utilized in hospitals and health systems. And basically now, as I interact with patients, I'm not your typical doctor that sits in front of their computer and types everything. When they talk and interact with their patients, I have an AI agent that's doing ambient transcribing as we're talking to the patient in real time. And when we're done, everything gets transcribed and the note is completed as the patient is leaving the room because everything got transcribed. And I basically review that with the patient also. And I say, okay, this is what we said. And this is what what we planned, and the patient is happy because I'm looking at them, I'm interacting with them, I'm talking to them, and I'm not typing all the time as other doctors do. So it creates a significant interaction between myself and the patient, and it's a more patients feel that there's more empathy, there's more interaction, more eye-to-eye contact, and the AI is helping the human connection, enhancing the human connection by basically being a supplement in the exam room to the physician and the patient experience.
That's fantastic. And I could see, I'm just picturing even like in regular going to a doctor's office, if they can just have that doing it. It seems they're on their laptop, while they're evaluating you for, let's say, the flu or you've been having some chest pain or whatever, but they're on their computer typing stuff in as you're talking. I agree. This is like 100% and definitely the wave of the future, and how it has come since you said the infant days, and now like everybody is getting involved in it. And are you using that more heavily today than you used to? In other words, is it growing?
Absolutely. It is growing. It's enhanced more. It is more intelligent. It is more understanding. So, for example, I had an interaction with a patient in Spanish, and basically, I thought, oh, I don't know, is this going to understand? So I clicked the button. So basically, to activate it, you just click the button to start the session. And lo and behold, it just understood everything that was said in Spanish. It just switched language and transcribed everything in English.
Amazing.
My family is originally from the Middle East, so I speak Arabic. I saw a patient in Arabic, and it understood everything, transcribed everything. So it is significantly better. I know for sure that 4 years ago it didn't know Arabic. Now they have added the capabilities of listening to any language encounter and transcribing it. So whether it's Arabic, Spanish, English, so the AI agent is able to understand what was said, transcribe it in a clinical note that I would review, and ultimately the approval is to me, and then I would sign the note. But the AI agent is there, ready, and it does also do certain limited tasks if I wanted to, and as retrieving blood work or initiating prior authorization or initiating prescription renewals. The agent is able to do that. The
Yes.
AI agent is able to do that.
It's amazing. How much time is it cut?
Significant amount of time. I mean, I used to, in the olden days, I used to see my patients, and then basically I would come back home and I would have 2 or 3 hours of charting and noting, and then once I did that, it just cut it by. So instead of that 3 hours of charting and noting, it's 20 minutes, half an hour of reviewing the notes that got transcribed by the AI agent, and that's it, just signing them off. So a significant amount of time saved, and the patients is happier. The patients are happier. I don't have to write anything. I'm just giving them 100% eye contact interaction with me, and it does enhance significantly the patient experience. And I can't emphasize that more, because patients comment on that. They say, well, Dr. Rifai, you look me in the eye and you talk to me, even if it's 5 or 10 minutes. I go to my primary care doctor and he's just typing on the computer all the time and just Epic, using Epic.
Just like what I said, yeah.
Yeah. But you, Dr. Rifai, you just sitting like this, happy and comfortable and talking to me. So I think there's a significant component of patient satisfaction.
Do you think it is increased your percentage as far as accuracy because you're not missing some key things that maybe a patient said, because before you would have been typing and not your full focus?
Sure, absolutely. It actually, it's very good, because as me and the patient are conversing and there's an item that we think needs clinical attention, and I would tell the patient, okay, hold on a second, I'm going to dictate, I'm going to tell the transcription, the AI, for that to put that as a note for us to review next time. So when the patient comes back next time, I get a screen that flashes from the previous visit and say, okay, Dr. Rifai, these are the items that you said last visit that you're going to talk with the patient or that you're going to follow up with the patient on. So it's not just that visit. You get prompts for the next visit of what's going on or what things should be followed up on, or what other things should be followed up on in terms of medications, in terms of following up on labs, in terms of following up on paperwork that the patient needs. So there's AI agent is also able to generate prompts and notes to the doctor for things to follow up on.
So it's learning.
It's learning. Yes, absolutely. Absolutely. And its accuracy with transcription is improving all the time, as long as you give it feedback. So you have to actively give it feedback. If you don't like the way it is structuring the notes, you can give it feedback and you can say, okay, you highlight a paragraph and you say, this is how you wrote this paragraph. This is how I like you to rewrite this paragraph. This is how I would have written it. And you can dictate it and say, AI, this is how I would love. So the AI can learn, can get prompts and can learn. So you can do it 1 time, 2 times, 3 times. And that's basically how large language models actually work, is basically that they learn from when you give them feedback. And so that's how it's very, very helpful.
So what ethical or human challenges come with using AI in mental health and addiction treatment?
I think one of the main ethical challenges that we are seeing is utilizing AI as a treater. These AI chatbots that are prevailing now, and we are seeing statistically that there is a significant percentage of adolescents that are confiding into AI. It's like, ChatGPT, I'm feeling very depressed, or ChatGPT, I'm like they're professing to ChatGPT that they're having suicidal thoughts, and all of these things, and sometimes the ChatGPT doesn't know what to do. It's not, and ChatGPT doesn't tell them to call 911 or to reach out to 988 or to talk to a real therapist. It just tells them what it perceives that they like to hear. It's like, okay, yes, maybe it's, and we've seen cases where the AI chatbot or the AI agents gave bad advice to the patient.
Just recently, it was big in the news.
Yeah, that even detrimental, even telling a person that they may be better off dead than alive. So we are there. There's not a lot of guardrails for that system, the AI system being created. We are seeing that state legislators are starting to basically enact legislation to ban the utilization of therapy as chatbots. For example, I know Ohio, they just passed a law banning chatbots, banning AI doing psychotherapy.
Okay. And do you think that is a good thing, or do you think maybe they should have just paused things until we can rectify that, like they supposedly did in ChatGPT, with that they said they have fixed that will no longer happen, where the ChatGPT is prompting the person he's better off dead or kill himself.
And I mean, basically, they're saying now that ChatGPT is no longer going to give medical advice. Is gonna have a disclaimer that it's not giving medical advice, because that's the other thing, is medical advice. So a lay person would go to ChatGPT and asks and lists symptoms that they're experiencing and say, "Well, ChatGPT, what do you think I have?" Or a youngster or an adolescent goes to ChatGPT and says, "I'm depressed and I'm not happy with my life and this and that," and then asks ChatGPT for advice and whether they're depressed and whether they need antidepressants or whether they should smoke marijuana, or whether all of sorts of advice that's being asked from ChatGPT these days. And there's no guardrails for that. And a lot of youngsters are lonely and they don't have interactions with the outside world, and ChatGPT is a window that they see that they are utilizing, and it's pretty unfortunate.
And it came on so fast. AI is really, the last couple of years, but really the last year has been like 100 miles an hour. Every month something new ability of AI is coming on. That's what we're seeing in the industry. Some amazing stuff, but like you said, it's not perfect yet.
And we are seeing that basically, AI's capacity to do things is significantly improved, as the ability to do computations, the ability to basically to model things, but it's still lacking from there. There's a lot of things that AI cannot do. Reasoning, ethical dilemmas, things like that, interaction with human, kind of the fine nuances of human interaction and the fine nuances of emotions and feelings. AI is still significantly behind. It's still in its infancy. So basically, it tells a person what it perceives that the person will like. It will not criticize a person. So it'll tell them what they perceive that they like, and kind of self-congratulate a person. My mentor is a psychiatrist. He was the director of the National Institute of Mental Health, Dr. Tom Insel, and he actually wrote a piece. He wrote his memoirs for about 7 or 8 years, and the memoirs talks about his career and his discoveries and things like that. And then he actually fed it to the AI agent, to ChatGPT, to see if it comments on him. And basically, it was positive affirmation all the time. It didn't do any criticism or like, why did you do this? Even though he personally acknowledges that some of the things that he did in his career were not right, and he would like them to have done them differently. ChatGPT was congratulatory and is like positive about it. So it's pretty interesting.
You advocate for physicians and system reform. How has that mission evolved in your own experience?
I think understanding. I advocate for AI, but I have to tell you, I am somebody who, as I say, I got burned by AI. Really significantly. So I had some legal trouble, and part of the legal troubles that I experienced was actually related to some data that was trumped up by AI. So AI
Really?
hallucinated some billing data. About a few years ago, I got in trouble with the federal government with billing. And things escalated significantly to like a criminal indictment. And I went to trial, and I was found not guilty. And you see my book behind me, Dr. Not Guilty.
Okay.
And so one of the major component of that was that some of the data that the government presented was false data, was hallucinated data. The AI agent that...
Can you explain hallucinated data to the audience?
So hallucinated data is basically data that the AI fabricates. So the AI agent looks at, because it wants to please the person who's doing the query. So basically, it has to produce something. So they fed it a large data set of our billing data, my billing data of about 10 years. And they wanted to see if I billed on any patients after their date of death. So after the patient died.
Oh, okay.
And which was like, that's fraud. Why would you bill on a patient after they died? You didn't see them. And so they fed the AI a large data set, and it produces 30 instances where it says, I billed on patients after they died.
Wow.
And so when we actually dug into that data set and we did analysis, there was about 6 or 7 patients that AI said I billed on, but their date of death was before I was born.
Really?
Yes. So we could immediately figure out that this was hallucinated data by AI.
Okay.
AI said that I billed on patients when I was in kindergarten. I billed on patients when I was in high school, dead patients when I was in high school. I billed on dead patients when I was in medical school, before when I was in residency. There was it's an impossibility because I wouldn't have known these patients. I didn't even start my practice prior to that. So there was no way for me to know that data, or these people died.
It was kind of ridiculous.
But the AI didn't know those nuances. So it presented to the government 30 dates. And what happened is the government didn't review that data.
They didn't fact check.
They didn't fact check. They said, "Oh, we got him billing on dead patients, on 30 dead patients. We got him." And it wasn't until we went to court and we showed the jury, like, look, the government used AI. This is this is not valid data. So there is a negative side of that, and now they're using data. They're using active AI for facial recognition. They're using you're reading in the news that Department of Homeland Security, Immigration and Custom Enforcement now has these software, facial recognition software that could take a picture of one person and would know their immigration status, and they would have every data about him since he was born. But I could tell you that is AI is not there. Accuracy is very, very problematic. Now, facial recognition, there may be a little bit more because it uses multiple points, but there is significant room for error. And so we got to be very, very careful. So with AI transcription, I'm always very, very careful. I reread the note with how AI is structuring things, because I don't want it to put in the record things that are not valid.
You see, it's playing a huge role in healthcare, from what you had talked about, predictive analytics to mental health, chat box. Where do you see the most promise in AI for psychiatry and addiction medicine?
I think the ambient transcribing is very, very important. I think there's a big promise with that. There are things that AI shines in very, very well. Mostly so, like we talked about facial recognition. It could shine very, very well in image analysis. So, for example, in my field, in psychiatry, some of the medications that we prescribe cause side effects, and individuals may have changes in facial features, face movements, involuntary face movement, a condition called tardive dyskinesia, where people would have maybe lip quivering or tongue movements that are uncontrolled, sometimes facial twitching, sometimes arm tremor. These are things that could be picked up by AI a little bit more, even sometimes than the doctor. There is a promising research about, for example, changes in the voice when people start developing cognitive issues. There are changes in their voice. So like early dementia, a person's voice starts changing, or somebody who has Parkinson's disease. So these are all nuances where AI could excel in that, because it picks up patterns and it picks up small changes that humans may not be able to pick.
So these things you just talked about, the voice changes, are already known, but by using AI, you're saying that diagnosis and being able could pick it up quicker.
Absolutely.
Okay.
So I'm involved in actually research, but in order for the AI to reach that level of accuracy, you have to train it. So we have clinical trials where the individuals who are having these side effects are being filmed for like a 60-second film that you would show it to doctors, and then the doctors would put the diagnosis, and then you would show it to AI and see if the AI can learn. So if the AI doesn't pick up on it, you can tell the AI, well, this patient that you saw and you didn't think there was anything wrong with them, 5 other doctors saw them and they think that there's something wrong with them. And so the AI learned. But in cases like this, you need large numbers. So
Large
we're
case.
talking about 10,000, 20,000 patients for the AI at least to start learning to be able to recognize these patterns. So that requires a lot of work, a lot of teaching of the AI, and a lot of contributing to the model. So our work with AI is not done. I mean, we have to teach it a lot to be able for it to do the things that we like it to do. Same thing, for example, with a call agent or an answering agent, for example. That's the most common and popular model that people like to use, somebody to answer the phone. You have to teach it. You have to teach it at all the probability of what the client is going to ask.
I was just going to actually ask you your other paperwork, billing, that type of stuff. Are you using it in your office?
Yes. Yeah. So we use an AI agent to help us with medication prior authorization, but you still have to teach it. And it still will encounter cases that it hasn't seen before, where you actually have to go in and put some actual input. But then the AI will learn for the next time. But
right.
Some of these things you have to do a lot of input into the AI model for it to understand.
Oh, fantastic information. How is it helping? So in the next 6 to 12 months, where do you see your business, Blue Mountain, which we haven't even really dove that deep into, but where do you see that going? Well, I think what you talked about is mostly what you do in your practice, but
yes,
I know you want to grow it.
Yes.
How are you thinking in the next 6 months to a year? Where do you think you're going?
I think automation with most tasks, I think, is very, very important. I think it would be very, very helpful. So we have a chat bot that's on our website that would answer questions, and so we're trying to teach it. But we also have an answering chat bot. We're also trying to teach it. The problem is there's so many variables in terms of insurance issues and things like that. We've been trying to work on teaching it the different variables now for about a year. It still has cases where it's just has to forward it to a live person to be able to answer, just because of the nuances of the field of psychiatry. But if you continue to,
is it getting less and less though as you're teaching it?
It's getting less and less, but there's still a significant. There's still about a 30% referral to a live agent.
Okay.
In terms of kind of the difficult things, we do interventional psychiatry. We do people who are a lot of our patients kind of just don't have any patience to talk to an AI agent, and they just kind of click agent. So like, or live person or receptionist, or so we hear that on the recorded conversations that we review sometime from time to time.
Quickly tell us about Blue Mountain Psychiatry.
We're a psychiatry practice in the greater Lehigh Valley in Pennsylvania. We're about an hour west of New York City, an hour and 15 minutes northwest of Philadelphia. We've been in existence for almost 15 years. We do interventional psychiatry. We treat people who have severe psychiatric problems, and we're spread out on 3 offices, and we have lots of doctors, lots of nurse practitioners, and we continue to be able to see patients and help them in terms of their psychiatric issues.
Have you been using AI? This just went into my head to help you diagnose certain like bipolar, schizophrenia, different.
I think it's coming.
On the patient's.
I think it's coming. There is treatment. So actually, I just gave prior to your podcast, I just gave a podcast around noon talking about something called prescription digital therapeutics. So there are apps now that treat or help with treating a disease. There's apps that are FDA approved that help treat depression, that help treat ADHD, that helps treat addiction. They're FDA approved, and they're adjunct to medications and other interventions. So they're basically the apps are available and could be prescribed by a doctor, and they're FDA approved. So I see this as a pattern that's going to expand. I don't see where chatbot therapy bots are going to be that effective, but we're going to have to see. But I think that AI has significant promise for both diagnosis, maybe not ready yet for any treatment modalities yet.
Okay. You're still open to it.
Absolutely. As long as there's enough safeguards and
absolutely.
Patients are kept safe.
So, I mean, we've talked about a lot of different things with your business. What is the biggest pain point you have right now? If you had to solve one thing, what would it be in your business?
Billing and prior authorizations. I mean, I think those are kind of just the most difficult ones that we encounter. And so I think that if AI progresses to significantly to help out with medical billing, because that's a very complex task.
Can you go in a little deeper on that?
So kind of just understanding the billing codes, understanding how to bill for a medical visit, sending the bills, understanding the nuances of co-payments and the nuances of co-insurance and multiple insurances. So there's a lot that where AI has not succeeded yet, just because there's a lot of human factors and human nuances to that.
Yeah, medical is a little different from, say, an attorney or something like that. I dealt with a few attorneys and that's I know medical billing is a lot different.
Absolutely. I hope there's some AI agents that are going to be helpful in terms of basically reducing the amount of personnel that are involved with medical billing.
Absolutely, yeah. There's that is definitely high promise on that. I know it's coming. We actually dealing with some stuff that's working now, but it's coming. I feel AI. It's just like the computers took years to get better and smaller and more faster. The speed AI is just like
accelerating. Absolutely.
Yeah, it's. I have never seen anything like it. You and I are probably around the same age, and I'm just like I'm like, really, like, even I'm in the business, and I'm like, really now? Okay. And every week we get something else dropped on us. And it's just amazing. It has been fantastic talking with you today. All right, Dr. Rifai, thank you for sharing your incredible insights on healing technology and your leadership in AI. For our listeners, don't forget to subscribe, like, and share this episode and explore more conversations like this at visionaryaipartners.com. You can also connect with us through our YouTube channel, Stay Visionary Podcast. Until next time, stay visionary.